The number of rising COVID-19 cases is causing a nationwide shortage in testing supplies. The county of San Diego announced this week it's changing who can get a test at its free sites. The priority will be focused on those who fall in the high-risk category, such as healthcare workers and people with underlying health conditions. But ABC 10 News reporter Mimi Alcala explains some local institutions are looking at pool testing to tackle that problem.
I think it's going to get worse in the short term.
While the nation deals with yet another COVID-19 testing supply shortage as the number of positive cases continues to rise, the county of San Diego is encouraging only those who have symptoms or fall under the high-risk category to be tested at this time, making it difficult or impossible for asymptomatic people to know if they're carrying the virus. UCSD Health is looking at new ways to tackle the growing problem.
Really across San Diego, institutions have been coming to us, experiencing shortages of testing supplies. And there's the option of, rather than having one patient per one test, to try to put multiple different patients together and perform one test on that pool of patients together.
Dr. David Pride is the director of the molecular microbiology lab at UCSD Health. He says using pool or batch testing could help their current testing supply last much longer.
They can take a nasal swab, a nasopharyngeal swab, or an oropharyngeal swab, and we just take those specimens and we put them together.
He says the key is to spot the large number of patients who need to be tested but don't appear to have the virus. The group swabs would then be combined and tested at once.
If that pool is negative, then all the patients are negative. If that pool is positive, then you need to go back and test each one individually.
The strategy could be put to use in the next couple of weeks.
Something that we certainly have validated to demonstrate that it can work. We have submitted our strategy to the FDA and have gotten pretty good feedback about doing it.
But Dr. Eric McDonald, the medical director of the county's epidemiology department, said with our current positivity rate across the county, the technique might not be too beneficial at all labs. Mimi Alcala, ABC 10 News.